Hi, I'm Sergeant Branham, and on the line is also Sergeant Arnold. We are your local Air Force recruiters for officer sessions, and one of the specialties that we cover is the Podiatric Surgeon, both fully qualified and the HPSP program. Also on the line is Colonel Contreras and Captain. What's your last name?
Genualdi.
All right. Very well, Dad. Anyway, so as for me, I'm Sergeant Branham. I've been in the Air Force going on 20 years. Married, 2 kids, aircraft maintenance by trade. This is my second stint in recruiting with about a 7-year break in between. I figured that this would be a great way for me to give back to the service that's done so much to me by coming back and helping young people such as yourselves out in joining the service. So that's a little bit about me. Sergeant Arnold.
Yeah, thanks so much. Yeah, I'm Sergeant Arnold. I've been in the Air Force for 18 years and been in recruiting for 9 years now. And yeah, I'm excited to be able to have Lieutenant Colonel Contreras and Captain G on the line. Thank you guys for being here. We appreciate it. Any information that you can give as the actual schmees is absolutely amazing. So we are very excited to have you guys on the line again. So yeah, we'll get started with the briefing here.
Right. And we also have Major Brooks, I see.
Oh, hi, Major Brooks.
You're on mute.
Makes sense. Can you see me and hear me now?
Yes,
Yes.
absolutely.
Perfect.
All right.
They're recording right now.
Okay.
For today's agenda, we're going to discuss some of the eligibility requirements, the position description, training and professional growth, advantages to being a podiatric surgeon in the Air Force benefits, the steps to join if this is something you decide you want to do, and we will go through any Q&A that we have.
All right, so eligibility requirements for fully qualified is you have to pass the military physical, be a U.S. citizen. The age cutoff for this program is 42 or under. Have a valid and current unrestricted license. And then also direct accession candidate must be board qualified and or board certified with the American Board of Foot and Ankle Surgery. Also requires a doctorate of podiatric medicine degree from a school or college of podiatric medicine accredited by the Council on Podiatric Medical Education and successfully completing a 3-year podiatric medicine and surgery residency accredited by the Council on Podiatric Medical Education.
Eligibility requirements for the HPSP. You must be able to pass the military physical. That is a medical physical. We're not talking push-ups, running, and sit-ups yet. This will just make sure that you're healthy enough to join. You have to be a U.S. citizen. You must maintain a GPA of 3.0 or higher. You must be at least, or at most, 39 years old once you complete the program. And you have to be enrolled in a school of podiatric medicine accredited by the Council on Podiatric Medical Education.
And one thing, if I can interject on the HPSP, it's best to apply in that first year of podiatric medical school. It is a 3-year program, so therefore applying in that first year so you can have your last 3 years kind of dealt with is ideal.
All right, so position description. Air Force people need to be fit from head to toe to perform at their best. Air Force podiatric surgeons treat foot and ankle problems of active duty personnel, retirees, and their families. Air Force podiatric surgeons enjoy a full scope of practice that can include sports medicine, podiatrics, Sorry.
Or pediatrics.
There you go. And trauma and reconstructive foot and ankle surgery.
Yeah, one of the things there to kind of take away is that you can make it what you want, depending on where you're at. Everywhere you go at the medical treatment facilities, it's a different world. So I think that one thing that should be stressed is that it's not going to be the same everywhere. I just recently PCS to Nellis in Las Vegas after coming from Right Pat, which Major Brooks was my replacement over there. So he's at Right Pat over there now. And I can tell you for a fact that each spot is going to be a different way of practicing. And how you guys got that old picture of mine is beyond me, but.
And I mean, I can say from my end as well, from the patient perspective, I've been unfortunate to have plantar fasciitis in both feet, as well as bursitis right around my left Achilles. And yeah, the podiatrists are a godsend. It wasn't you, but I can't thank you guys enough. It really is important, in that matter. But anyways, moving forward. So training as an Air Force podiatric surgeon. As a podiatric surgeon, you'll be a member of the BSc, the Biomedical Sciences Corps, and also a highly respected member of one of the world's premier healthcare teams. You'll enter active duty and attend the 8-week commissioned officer training program at Maxwell Air Force Base in Alabama. That course is aligned in a 4-phased approach: orientation, development, application, and transition. It is primarily a leadership course, sets you up for success. Sir, would you like to interject on that one? What was your experience with it?
Well, my experience, it's a little different now than it was when I came in about 15 years ago. And I think even with Brooks, I don't know if Captain Generality may want to chime in, but it's a little longer now. But basically, that's where you're going to learn how to march, how to salute, and learn a bit more about the Air Force and how it works. Not so much on the medical side, but more so on the line side and how the big Air Force works. I don't know if Brooks or Generality want to chime in there.
I could chime in a little bit. So I did ROTC, so I went and did field training down at Tyndall Air Force Base, 4 weeks. So if you're going through ROTC program, then yes, that's the route that you go. But of course, that would be during undergrad. There's not really a route once you finish with undergrad to join like a detachment or something. Not yet. Some other grad programs, yes.
Yeah, but it's I mean, you liken it to the basic boot camp kind of ordeal, what you want to, I guess, the stereotype kind of way. It's a little bit different, but you should have fun with it as well. I know for us, we were there with the BOT, which was the basic officer training, which is a bit different, but we had fun kind of competing against each other and calling each other names from afar early in the morning at 4 o'clock in the morning while you're running and doing all kinds of calisthenics and that sort of thing. But it's basically your introductory to the military way of life per se.
Cool. So some of the advantages to being a podiatric surgeon in the Air Force: paid CMEs, no overhead costs, no leases or payrolls, no people to hire or train, no equipment to buy or maintain, ready-made clinic, established patient base, no malpractice insurance, licensure is good in all states, a 20-year retirement plan, and small, medium, or large clinic settings are available.
Yeah, that I kind of spoke to you two a little bit before, but for me, I was in private practice for almost 10 years. And for me, private practice was quote killing me because of all the insurance companies and overhead and group practices and that sort of thing, where now I don't have to worry about any of that. Your staff is basically predetermined by the Air Force as far as what that's going to come through. What's nice is you get paid CME. They'll pay for your board certification. And I know Captain Generality, I don't know if he's still on the line or not, but he just, okay. Well, he just gave me the great news that he got board certified. He got notification rear foot certified yesterday. So, you know, little things like that you can still accomplish while in the military, which a lot of people on the outside may not know that you can. I mean, I achieved my rear foot certification with the Air Force as well, even though I already came in foot certified when I came in like 15 years ago. But the no malpractice, all you need is one license from a state in the United States or one of the US territories, which basically it's the state of the United States. All you need is one license. And one of the nice things is you get to travel places, you know, little things like manning assists and being stationed at one location, let's say in San Antonio, and being able to practice up in Langley, which is in Virginia, for 6 weeks. Out of nowhere, you get there, and one day after the next, you're already treating patients, and you know, and or at least getting to know other parts of the country. I know Brooks and I did that for a little bit about 10, 12 years ago at Langley when their podiatric surgeon there was deployed for a little bit. But you know, it can get exciting.
All right, so more advantages to being a podiatric surgeon in the Air Force. Commensurate salaries with additional pay on top of your commission pay, comprehensive medical and dental coverage, and established practice in group clinic or hospital settings, access to excellent colleague consultations on a daily basis, 30 days of vacation with pay per year. You can carry up to 60. There's no malpractice insurance. You have an educated and loyal patient base that will follow treatment plans, no overhead expenditures, no staffing concerns, payroll headaches, tax issues, logistics, and supply problems. Anything else you want to elaborate on, sir?
Keto, you wanna chime in there? Or Joe?
Yes, I'm here. Yeah, the 30 days of leave is nice for sure. Even though I have probably over 40 days accumulated now, but it's nice having that available to you. The federal holidays, we get family days with those. So yes, there's a lot of advantages and quality of life that goes beyond what they may initially see or may initially be told by people that they know. So getting all the information from the recruiters is certainly beneficial to give everyone the full picture.
I don't know if Major Brooks wants to chime in because he spent a ton of time away from the continental United States. So he could chime in on the travel, definitely.
All right. Most definitely. Yes, it was nice being stationed overseas. If you have family, especially if you're at Ramstein, where I was stationed for the past 3 years before I got here to Wright Pat. Yeah, you could get around Europe pretty easily. Take the train, take planes. You get the time off. It's always paid holidays as well, of course, so that's always good. And there's a lot of 4-day weekends.
and to know, since we're living in in these COVID times, and hopefully we're on the way down. You know, last year when COVID hit, you know, it hit the entire country, the entire world. But you know what? I was somewhat grateful for being in the military, because there were a lot of people that were losing their jobs, but I still had mine, you know, and I still had a paycheck, and that's something to be grateful for. But you know, there are a lot of advantages to it. Now, you know, commiserate salaries, you know, you can compare it. You can compare it. You know, again, was I making more money on the outside? Sure, but I think the benefits outweigh the monetary value, personally.
All right, so some of the benefits to becoming a podiatric surgeon for the Air Force in general is the excellent starting salary that's offered with regular pay raises and promotions, 30 days of vacation that are paid for each year, continuing education opportunities, tax-free housing and food allowances, comprehensive medical and dental care, opportunities to live, work, and travel worldwide, and the generous retirement program.
Yeah, definitely. I can tell you, at least for the vacation days and that sort of thing. I know when I first came in, I think within 2 years or so, I took 3 weeks off and went to South America. So, you know, little things like that. The tax-free housing, you know, you get a stipend for, it's basically a stipend for housing, for sustenance. You know, they give you some money for food and that sort of thing. And with a family with 3 kids, so it's a family of 5, you know, the comprehensive medical and dental care comes into play. It's something that you don't have to pay for. I mean, all being said, I mean, there are some instances, if you wanted to, if you chose to go that route, you can pay for a little bit. You could pay for a little bit more. However, it's nice to not have to worry about that. Okay. The other thing is, when you're coming up in 10 years or so, there's also the post 9/11 bill, which you can transfer to your spouse almost immediately, and your kids once you reach 10 years of service. And I'm here to tell you, with 3 kids, with the last one that just graduated Texas A&M and the Corps Cadets, and who commissioned her like 4 weeks ago now. All 3 of my kids are all college grads, and they all took part in that transfer of benefits for the 9/11 bill. And another thing that what people won't tell you, even recruiters out there, because they may not know, is the public service loan forgiveness program. There is, once you have federal loans, you know, direct loans and that sort of thing, when your undergrad loans or even podiatric medical school loans, if you work for a government entity or public entity for at least 10 years, okay, and you make 120 payments on those loans, okay, whatever's left over after that 120 payments, so the reduced payments, they will forgive, which means that, let's say, for example, I got $100,000 in loans, I joined the Air Force, and I agree to stay in for 10 years, and I'm paying on those loans at a reduced rate for 120 payments, okay, just 120 payments. And let's say the balance on that loan is, I don't know, $80,000, okay? Then by the time you pay your last payment, that $80,000 goes away. And it goes away to the point where it's not counted towards your taxes. Okay, so it's not counted as income. It literally goes away and it's forgiven, and you don't have to pay the rest back. So that's something that I think everybody should know about, especially the recruiters. We're not only recruiting us, but recruiting anybody, because that's something that can save people a ton of money. And the retirement program, even though the retirement program has changed since I've been in, I'm still under the old retirement program, you do your 20 years and you get a pension. You can't get that on the outside like that, okay, in a private practice setting, in that sense. So so again, the advantages outweigh the monetary value.
All right, next step. So if you decide that you want to join the Air Force, the first step is you'll complete your initial appointment with either myself or Sergeant Arnold. At which point we will ask you to provide your source documents, which is like your driver's license, birth certificate, social security card, passport, any licenses and certifications you may have, important documentation like that. Once we have that information, we will place you in the system and start your profile. Once the profile is initially built, we will turn you over to our pre-processing team. The pre-processing team will work with you to do all your forms, get you scheduled to take that physical we mentioned earlier, and help you build your application, set you up with your interviews, things to that nature. Once the application is built and it is board ready, it will be submitted to a board who is going to determine whether or not you are a viable candidate in this program. If you are selected, then you will be transferred over to the post-processing cell, who will help you do your commissioning documentation, anything with security clearances, stuff to that nature, and basically just prepare you to head off to OTS. So that is the steps in a nutshell.
Yeah, one of the big things is I will usually get an email. I didn't say this before, but I'm the podiatric surgery consultant to the Air Force Surgeon General. So a lot of these calls and contacts will come to me. If I can't do it, I will send it to someone like Major Brooks, and probably pretty soon Captain Generality there. Anyway, so I will review and say, okay, this person can go ahead. We can go ahead with with an interview with this person, or should I say with this candidate. One little bit of advice. I don't know if either Brooks or Generality want to chime in, but one bit of advice is you definitely want to be yourself. You don't want to hide anything. You don't want to be someone you're not. Okay, because I know for me, I can smell that a mile away. But it's one of those things. What we really want to know is, why do you want to come into the Air Force? Okay, why do you want to come into the world's best Air Force and to do what you do? And what do you like to do? So that's some of the things that will happen. I don't know if you guys want to chime in at least with your interview experiences, or I know Major Brooks has done interviews as well. So
Yes, I'll chime in. So just like Colonel Contreras said, members that want to join, come to the interview process, just make sure you're yourself. Don't try to hide anything, because we can usually see how your character is. We have record review as well. So yeah, just have confidence in an interview and go from there.
Yes, and I had experience with two different healthcare recruiters. One when I was in residency in New Jersey, and then was pretty much told that maybe some of my prior orthopedic injuries would be disqualifying, and they pretty much kind of stopped the questions at that point. But then when I got down to Florida and wanted to reconsider getting into the Air Force, the recruiter did a wonderful job of getting me situated with what documents would be needed, who else I can talk to as far as consultant wise. But yeah, just being persistent, and that was the key for me. But if I had just stopped after being told that an old wrist fracture, a shoulder injury would have prevented me from continuing a career in the Air Force, then probably not the only person that may have been instructed that, or kind of misguided. Now, were they not hiring that year? I don't know. It depends on what the Air Force's needs are, of course.
Right.
But I have just that kind of information to pass along, that two different years experience of trying to get in. But once all the paperwork was collected, and I had to get the Surgeon General to have a waiver for the shoulder, which at that time I didn't know what that meant. I was like, oh no, is that gonna pretty much stop the application and everything? But no, it went through. It's just something that was in the records, and I'm not gonna not that I'm seeking any type of benefit for my shoulder, because it's fine, but it's just something that goes in your record, and you can continue to do your duties without any issues.
And another point to make, you make a great point, Joe. Another point to make, at least for the recruiting side, is if you just don't know, contact one of us. I mean, you got our contact information. Email is probably better for me, because I get a lot of robocalls, so I don't answer a whole lot of calls. But just ask the question. I get contacts all over the country all the time, say, hey sir, this is Master Sergeant, Staff Sergeant, whoever, I got a question about a candidate. And then if you just don't know, then just ask, and I can steer you in hopefully the right direction, and so we can get your candidate in, or at least get their package in for consideration.
Awesome. Yeah, so just a couple of questions that I actually have from people that are in the field.
Okay.
The first question is like, what does your typical day look like as an Air Force podiatrist?
Well, my particular day, as you go up in rank, you start kind of what we like to call fly a desk. Okay, so I'm gonna leave this to probably our newer of the group, probably Joe there, to answer that question.
So yes, I'll start seeing patients at 8 o'clock, and that's Monday through Thursday now. Friday, I'm in the operating room, and then we'll see. I think we're templated to see about 19 patients a day. That's some form of face-to-face encounters versus I have just a handful of virtuals templated in. But under 20 patients for the clinic days, and then there'll be some procedures built in. Where I'm at, it's me and one orthopedic provider, so everything foot and ankle is pretty much coming into my clinic, and then from there, if it's a surgical candidate, then we'll book them and get them into the OR. But yeah, about 20 patients a day, and then finish from 8 o'clock to roughly about 4 o'clock, and have most of the notes finished, and then I can go PT or do whatever I need to do from an administrative standpoint as a CGO, which isn't going to be the same as Colonel Contreras. So hopefully that answered your question.
Yeah, sure did. Thank you.
So one question that I've been asked is, what does a typical deployment look like for you guys?
Well, that's the thing. The Air Force does not deploy their podiatric surgeons. Okay, we are not on a UTC. If we were to deploy, we would have to either be at the right place at the right time, depending on how you look at that, okay, or volunteer for one. There's always opportunities that come out. A lot of times it is where the location, like for me, when I was first in, I went to, I was at Lackland, I was in San Antonio, and I took the Air Force Spanish test, okay? I'm originally from the Dominican Republic, so I took the Air Force Spanish test so I can seek out those types of opportunities. that may need those skills. And I took it on a Friday, and by Monday I was getting a call to see if they wanted to deploy me over to Honduras. But unfortunately, my squadron commander said no. So it was all about seeing the patients, because you don't necessarily are going to be deployed as a podiatric surgeon. You'll be doing something else, but you would have to have support from your unit in order for that to happen. Not about a year or two ago, while I was at Wright Pat, I had an opportunity to apply to be a commander of the medical element down at Joint Task Force Bravo in Honduras. But I came in as an alternate, but hey, it's the the attempt that counts. But little things like that will come up, but deployments, we don't have that mission as of yet.
All right, so the other one that I have here is, I mean, I know you don't deploy, but as far as humanitarian, do you guys help out with humanitarian missions at all, or
No,
is that still-
and that's what I was alluding to. I was trying to get on some of those humanitarian missions, because
Got it.
I know in San Antonio they did a lot down to Honduras, down to do all those things. And unfortunately, the year I got there, because we're assigned with orthopedic clinics, basically, right? And so I went to the orthopod at the time that kind of organized that on a yearly basis. And I told him, hey, look, I speak Spanish, I can do club feed, I can do a bunch of things and do the humanitarian out there. He's like, great. And then he was going to sign me up. And then about 6 weeks later, they basically nixed that whole program. So I don't know if it's just me, I'm just bad luck, or I don't know what the story is, but you would have to kind of be in the know and be at the right place at the right time.
All right, cool. And then the last question that we typically get is like who would be your patient population? Would that be more towards active duty? Or are you guys working everybody at every base, or is it different between large and smaller clinics?
Kira, you want to take that one?
Yes. So as far as the patient population, it changes between base to base. So when I was at Ramstein, I would say we had majority active duty members, but that's just because of the population locally. And there's just not a lot of retirees there. So here at Wright-Patterson, there's a larger retiree population. See Colonel Contreras smiling. So I have a lot more retirees here. But still, they're a good patient population. Every base that I've been to, the patient population has been fairly responsible as compared to, I know you could probably experience some patients on the outside who would be maybe a little more non-compliant, but I'd say compliance within the Air Force has been pretty good with all the patient population. And how do you guys feel about that?
Yeah, absolutely. I've been very pleased, and I think it's good for new practitioners to go into the military because everyone's pretty much healthy. I don't see anyone over 65, which I really don't have any post-operative complications, infections, knock on wood. A large part of that is because everyone is young and healthy. The NCR, there's a good number of satellite bases. And only 3 or 4 larger MTFs in the area. So it's a large pool. You get all the Pentagon dependents and spouses. So it depends on which base you're at, what the mission is there, but you're going to get good diversity as long as you're seeing active duty and the dependents and spouses. But depending on what your leadership has as far as the mission at the MTF and working with the group practice managers, you can kind of tailor what you want to some extent and with your templates and the booking protocols.
And that's why I wanted them to answer, especially Brooks, being he spent a long time, you know, overseas and coming back to the States and that sort of thing. But essentially, we're here for active duty, plain and simple. That's our readiness mission. Anywhere you go now, at every base, yes, the mission is slightly different, but overall, as an overarching standpoint, we are here for our active duty and to be there for them, to get them ready to provide the missions, to drop the bombs, to do our thing, right? But we can't see active duty dependents and retirees. I will tell you that there is a huge diversity, especially like when I was just at Wright Pat. A lot of my reconstructive cases, my fusions and things like that, were definitely out of the retiree population. And a lot of my sports type cases, the surgical cases, are out of my active duty population. So it changes, although I think it's pretty interesting, at least when I was looking at my numbers at Wright Pat and at Langley and those sort of things, excuse me, it normally comes up as far as surgical cases go, between the active duty and active duty dependents. Active duty by far operate on mostly. And then when these active duty become retirees, I'm not operating on those retirees from active duty. I'm operating on their dependents mostly, which is an interesting thought, an interesting concept. So we basically we fix y'all when you're on active duty, and then you're good to retire. But it's your dependents that you have to keep your eye on after you retire, because things start to degenerate from there. But but in essence, it's just like any other clinic on the outside. You're just seeing their patients. You have a good diversity of cases, and enough cases to keep you busy and you know, depending on what you like to do, but to keep you busy and keep you happy.
Cool. Awesome. Thanks for all the input. One last thing that I would ask of you guys is, would you have like any advice for the HPSPs or any advice for fully qualified who are interested in doing this program, or either or?
I'll take the fully qualified, I guess. And then I don't know if either one of you two want to take the HPSP. I think maybe Brooks, since he was ROTC, kind of HPSP like. But at least for fully qualified, if you're looking to get out of the rat race, if you're looking to treat our active duty, our veterans, you know, give back to your country, but also have a little bit of fun to go along with it. I think it's a fantastic idea. If you don't mind getting paid a little less, but think about all the benefits that come along with it. I think it's a fantastic idea. But one thing that you should concentrate on is to make sure that you're either board qualified or board certified by the American Board of Foot and Ankle Surgery before you even apply. That would be my one bit of advice.
Yeah, and as far as HPSP, people applying for that, you know, the first step, of course, is to apply. And I think just like Kanjanaldi said, you know, if you don't succeed, you know, don't be deterred. Make sure you try again, see if you can get in. And as far as like for HPSP program, one of the things that I could say, you know, it's probably gonna be a little different than the way I came in through ROTC, but yeah, you probably have a little more flexibility too, as far as you don't have to go to leadership labs during the day, right, or once a week. and you can concentrate more on learning your profession in school.
Right. The HPSP program is still pretty young, and we're talking about, let's say I apply this year and I get my HPSP. Okay, we don't see our active duty. The Air Force doesn't see that candidate back. Okay. We just got our first HPSP candidate this past year. And so that's been kind of like on a train now. And that's Captain Fluckiger who's out in San Antonio. But he's kind of like the quasi liaison for everything HPSP. And so kind of made him that. And so he's taken that on and kind of guided everybody behind him. But just like Major Brooks said, you have to apply, and don't be discouraged that if you don't make it, because it's usually just like one, candidate on average, depending. I think one year we may have had two, but that's really rare. But you're also competing, with everybody else for that one position. But it's it saying that, okay, I'll do my active duty, I'll do my 3-4 years or whatever I have to do, but in that meantime, hopefully get board certified and get out. That's also a possibility too. I mean, you do your time, thank you for your service, and then you can move on to bigger and better things, but also take advantage of everything that you possibly can at that particular time, particularly becoming board certified, because that's what's going to make you more marketable on the outside.
I agree. If I could have done the HPSP, I would have at that time, just to have the money not be such a concern as far as student loans. And I believe in residency, you may collect some housing allowance. So yeah, that's a great program that we should be getting dozens of applications for annually.
Yeah, and it's actually, and I've seen it in these last few years, more and more people are catching on, and more people are knowing about it, about the program itself, and they're applying. They're definitely applying.
All right. Well, I really appreciate you guys taking time out of your day to hop on here and speak your point of view about the podiatry in the Air Force. Really, thank you. I can't say that enough. So I'm going to go ahead and close it down unless you guys have anything else. We good?
No, you can contact any of us if you have any questions, even if it's just, hey, what about this? Or hey, what the heck is this? At any time, pretty much.
Yes,
Just make sure you know that Pacific time, not Eastern.
Yes, and for me, Eastern time. All right.
Awesome. All right. Well, thanks again, everybody. I really appreciate it.
Take care.
All right. Take care.